Okay, hello. Delighted to welcome you all to another episode of ideasSPACE with the Urban Design Group, UrbanNous, and me, Christopher Martin. I'm an urban designer and planner focusing on the design of public realm and streets, and I'm on the executive committee of the Urban Design Group. For this episode, we'll be focusing on childhood obesity, getting to the bottom of how the design of cities affects the health of our children, and what we must do to ensure healthy starts for children and create healthier places for people to grow up in. I'm joined by Sarah Hickey, Head of Strategy and Programme Director of the Childhood Obesity Programme at Guy's and St Thomas's. Sarah, thanks so much for joining us.
Thank you. Thanks for having me.
It's really kind that you've taken the time out to speak with us. And to get us started, I wonder if you can introduce the work that you do at Guy's and indeed talk about your 10-year programme to improve children's health.
Yes, thanks for the introduction, Chris. So, as you said, my name's Sarah and I'm the Programme Director at a charity called Guy's and St Thomas Charity. And we're an independent charitable foundation focused on urban health. So we're based in South London and we work primarily in the London boroughs of Lambeth and Southwark, trying to improve the health of the local population here. Our focus through that is a focus on a small number of complex health issues. So we take a really small number of health issues and we really try and stick with them over time. And what that looks like in practice is 4 programs, which are these. So we've got a program on childhood obesity, we've got a program on multiple long-term conditions, health effects of air pollution, and adolescent and child mental health. We chose these issues not just because they're complex and particularly prevalent in our area, but the urban environment we feel has a distinct role to play in how these play out for people. So that's the overall portfolio of issues that we focus on. So included in that is obviously this 10-year programme to tackle child obesity, which I oversee. The way we look at child obesity overall is through a frame of inequality. So the goal for our programme is to break and narrow as far as we possibly can this really strong link between neighbourhood level income and the rates of child obesity in that area. When we think about that locally, what we want to see in the 10 years is the rates of child obesity in our lower income neighbourhoods go down to match those that are currently in our wealthier areas. Our approach to do that is to focus on the spaces and places where children and families spend their time. Focus particularly on the food in those spaces, but also how physical activity is promoted or made more difficult as well. We've sort of split that into kind of home, school and streets. We work with a really wide range of partners to do that, spanning across the commercial, public and charity sector. Basically, we work with anyone who we think who can help us in this mission. And what we do with these different partners is try and really target the different cues in these spaces where children spend their time that are either a barrier to healthy eating or activity, or something that promotes it that we could really expand. I guess ultimately what we're trying to shift is the healthiness of these spaces, shift them away from what at the moment feels like a real flood of unhealthy food options and a big set of barriers around activity, to spaces that make eating well and moving just the absolute easiest thing to do. So this is some data from a report we put together last year with the Food Foundation, actually, which just maps places that you can buy food across the boroughs. And I guess first thing you notice is there's just lots of them. They're spaced along main roads. They're clustered somewhat towards the north of the boroughs, but just lots of options there. And then this is kind of one piece of snapshot data looking at what kinds of food options are available. And this type of data, and there's other kind of snapshot data like this, that seems to indicate that the quality of food in places that are average lower income is also worse than in higher average income areas. So you've got this combination between kind of individual household barriers. You know, there's a budgetary constraint, there's stressors on headspace, and obviously poverty comes with stressors often. And then also there's a kind of the external environment, which is also hard to navigate in terms of finding food options that both meet the needs of kind of affordability, convenience, you know, tastiness, as well as healthiness, and whilst being kind of bombarded by lots of options that are affordable, convenient, but hugely unhealthy. So I think those are some of the drivers behind child obesity generally, but I think particularly in cities, and then particularly in areas of lower average income. So the three takeaways, I think the first one was just how important high streets were, especially for young people. They were spending way much more time in high streets than other kind of public realms, like parks and other civic institutions. They were really sort of the hub of the place, not just for young people, for people generally, but especially young people. And where they were really hanging out was fast food places. And these fast food places had really systematic methods of marketing and communicating to young people, I think really attuned to their needs beyond affordable food. Mm-hmm. So that was the first thing I think was really important. It's like high streets really matter in shaping our eating habits in an urban environment. The other places was this interaction between fast food places and bus stops. And of course, no coincidence that the major fast food brands were located around transport hubs. So the transport hubs where lots of young people were congregating as they were kind of switching buses, getting on their bus for home. And as a result, the fast food places were kind of drawing them in. You know, there's somewhere to go while they were waiting, and somewhere to go that not only was providing food, but also providing really well-designed social spaces. And I guess that was the other, the real insights, that these kind of fast food places had started acting a bit like sort of civic spaces, civic beacons. When researchers were asking, you know, their peers essentially why they were in these places, it was about lots of things. Like, they're really well designed as semi-private spaces, so you can kind of sit and you feel kind of you've got your own space. They're safe, they're well lit, they've got Wi-Fi. They've often got, especially the independent ones, got really friendly people working there. They were just basically acting as civic spaces, and I think increasing in importance as other places such as youth centres disappeared. I'll unshare now.
Brilliant. Well, thanks for that. It's a really important work, and certainly something that we need to think about when shaping cities more and more, I think. Just to get to the sort of the real heart of the problem, I'm interested to know how we've ended up in this situation. Why do we have such a major challenge in London and indeed Southwark and Lambeth, as you say, with some of the highest rates of childhood obesity of any global city?
Yeah, it's interesting and challenging, because I think in many ways Lambeth and Southwark, they're sort of extreme versions of what's going on in London and what's going on nationally and actually globally in terms of the child obesity rates not only going up over time, but this really strong link between income poverty and child obesity, and that the strength of that link, that link becoming stronger over the last decade. So the gap between the child obesity rates in the poorest and richest areas has only widened, and your chances now of becoming obese or overweight if you're growing up in the poorest areas is over double that to growing up in the richest areas. And then, as you said, why is that? So there's obviously something about inequality there and income. So Lambeth and Southwark in particular has one of the highest rates of income inequality in the country. And, you know, why does income matter when it comes to eating well? I think it's a few things. It's The cost of a healthy diet is genuinely difficult to meet on a low income. So, and that's become harder over time as well. So there's an organisation called the Food Foundation who have costed up basically what public health guidance says is a healthy diet, kind of eat well guide, and costed that up for a family. So if you're on an income of under 20, between 10 and 20 grand, that's 30% of your disposable income you have to spend to get to that. It's quite a large chunk. So under 10 grand, it's over 50%. So it's quite, so that's one reason behind that. The other is the nature of the spaces in these densely populated urban environments. We are all kind of flooded with these with lots of options to eat in and of themselves, but also many more of those options are unhealthy than healthy.
I think just sort of having I think more about the sort of interventions you're talking about. I know from some of your reports, you've rightly said that no child can outrun a bad diet, which I think is really key. And indeed, you've warned us off thinking that physical activity alone is the answer, saying that about an 80-20 split with a focus on diet over exercise is a good rule of thumb in terms of a portfolio of interventions. You have highlighted, though, that incidental physical activity interventions such as active travel are useful, as they're easy to start and to incorporate into daily life. What do you think are the key takeaways from your work around that sort of eating psychology research and the sort of advantages of incidental activity in combating childhood obesity, and indeed the best areas to target in delivering this in a built environment?
Yeah. Oh, yeah, that's a big question. So where to start? I guess the place to start is to say, when you talk about eating behavior and physical activity, I mean, what we're talking about, what makes up what we eat, our diets, and how much exercise we do. It's a series of habits, daily habits. Habits are shaped by our internal motivations, assumptions, history, aspirations, interacting with the world around us and the cues that they give us, the cues, the barriers, the opportunities they give us. When it comes to food, the number of eating decisions that we make every day, I mean, it's hundreds. So it's very difficult to make a kind of a careful, informed decision at every one of those points, which I think is why our external environment becomes ever more powerful in kind of cueing us up to do certain things which either are or aren't in line with our habits. And then you add, as I said, you add additional pressure to that. For example, I've got a constrained budget. I can't kind of buy my way out of that, and I've got other even more things kind of constraining my headspace, so even less space to make these decisions, which means the external can really, really shape those habits. So what do you take from that? I guess you take from that solutions need to work. We need to work from that basis. So assume that that people have low budget, low time, and low headspace. How do you create things where really you're putting as little effort on people as possible, but you're achieving a healthier outcome? So kind of where a child or a parent, their daily journey, their daily needs, as they're kind of doing that, how do you create cues to create a healthier outcome? And I think that, so in the world of food, the absolute lowest effort example is reformulating products. So there was a government sugar tax. As a result, lots of fizzy drinks reduced their sugar content. From the point of view of the consumer and the citizen, their habits didn't have to change at all, but they were consuming less sugar. So that's the sort of I think that's the kind of perfect example, like no effort. Obviously, every solution can't get that far, but how can you, at least as near as possible, go where people are at? And I think the same applies to physical activity. It's going to be much harder to say to someone, okay, take from what you're doing now, spend more time, spend maybe more money, spend time out of your current schedule, or basically change your schedule, go to this exercise class, get onto this exercise program. It's a lot more effort you're asking of someone, as opposed to actually the journey you make already, the things you're doing already. How do you just bake in more physical exertion essentially into those journeys? So I think they're the kind of the psychology of it, the psychology of habits, I guess, and habit formation and habit change applies just as much, I think, in physical activity as it does in eating. And I guess it's all based on kind of behavioral science as well, about how do you make changes, make small changes, make as small a change as you can. Once you've got that banked, you can make the next one. That's probably going to be more likely to lead to success than trying to change everything overnight.
Yeah, it's an important point, and so much in urban design comes back to sort of make what's best the easiest, and I think
Absolutely.
it's a really important sort of takeaway, and sort of just sort of picking up some of the points there, and the fact that, so I think urban design has such a huge role to play in eliminating these obesogenic environments, which are environments that encourage obesity. The mayor's office in London acted to ban fast food outlets from around within a 400-meter radius of schools, I believe, and other policies banned advertising unhealthy food on public transportation. So this very much plays to the idea of helping people to make sort of little changes. Your work suggested that these are really positive steps, but potentially don't go far enough, if I understand rightly. And instead, we need to reduce access to fast food around places like transportation hubs as well, for example, which is a significant driver for health inequality, you suggest. What are the key points of consideration from this study, do you think, and what can we learn from it to apply elsewhere?
Yeah, I mean, I wouldn't want to undervalue what the Mayor of London did in banning fast food and banning advertising, because I think around schools, because he basically had to use his political capital to go against global corporate players, which I think is very, is kind of, is really important. And I think then that influenced the recent national government announcement that they're also going to make restrictions on advertising. And I think what we're saying is, like, yes, absolutely, yes, it's these steps are crucial but insufficient. And they're insufficient because they are one part, or they're basically ticking off one part of the incentives that children face to eat unhealthily in their day-to-day lives. That's because obviously 400 meters around their school, young people especially in urban places, are commuting further than a 400-meter radius to and from school, especially in secondary school. So we did a study with an organisation called GEL, an urban design organisation, who I'm sure you know. We did it with them and a group of community researchers who were local residents trained as researchers by an organisation called Social Innovation Partnership. What they did was really look from the point of view of people sort of moving along the streets in our borough, in two areas of our boroughs. From their perspective, what were they doing and why, and how did the places around them, including transport hubs, affect what they ate? So yeah, what's the takeaway from that? I think the importance of it. I guess the importance of thinking about what planning levers can be used to, on the one hand, incentivize or disincentivize unhealthy food, for example, but other unhealthy promotion in these places where children and others are congregating. But I think you need to think as well about what you're putting in as the alternative. The solution, as well as being healthier, needs to really meet these quite complex social needs of the people spending time there. And I think it's actually, you always need to look partly at how and why places like McDonald's there are so well designed. They are very, very in tune. They of course they're there at these transport hubs because they knew before we did this research that children are going to stop here, they're going to want to hang out, these are the things they're going to want to do, and then design for them. So I think it's also about really, I guess, design, like user need, I guess, and really understanding that, and kind of how do you incentivize organizations and industry that's coming in to take up space in these places? How do you incentivize them to be the healthier, but also how do you place user need at the heart of seeing what works, and where people are spending time?
Yeah, it's a really sort of enlightening study as well, and I think it's sort of it's a call to arms really for urban designers to sort of make sure that the traditional public spaces are as competitive and designed suitably for the age group as well, and make them really attractive and actually compete against these sort of potentially unhealthy environments. I think that's really important.
Yeah, and I've been, for us, because in the program as a whole, we sort of sit in two camps. Like, we are both trying to create competitors, as you say. For example, in the food manufacturing space, we're sort of trying to challenger brands that are going to disrupt the existing food system. But we're also actually trying to work with existing players. So I wonder whether, because, someone like McDonald's, they've got huge customer insight. Can you also work with them to make their offering healthier? So I think it's probably a bit of both. It's like directly out competing and creating planning laws and things that really stop some organizations being in these spaces. But I think it's also actually working with them to achieve the same great product and service, but with a healthier outcome, basically.
Yeah, very much so. I think talking about sort of collaborative working, I think there's a huge role for everyone to play in helping children stay at a healthy weight. And of course, political leadership, as you've already outlined, is incredibly important. Where it can add real firepower, I think, is bringing decision makers together under the sort of shared mandate of creating and sustaining healthy environments for children. I wonder if you could just sort of tell us where you think in the world is getting this right. And as well as sort of linked to that is, what do you need from policymakers and politicians, and what do you need from us as the designers of cities?
Yeah, I think it is really important. So firstly, because cities, I think, have just such big potential to tackle a complex issues like child obesity. They're big enough to hold quite a lot of the levers affecting the food and activity environments around children and families. So they're kind of at a scale big enough that sort of is almost a mini version of the global, the national and global system. But they're also small enough to make it feasible to do something which requires, as you say, lots of players, lots of initiatives happening together for a long period of time. So how do you enact that opportunity? Yes, I mean, political leadership is crucial, partly because the system you're trying to change is complex. So I think you need someone who basically says, this is important, and it's important for a very long time, because you need time to achieve all this. Someone also who can say, yes, this system is complex, but actually a lot of the solutions within it don't have to be massively complicated, but I am providing a spotlight and platform to call out all the different players and to kind of create transparency around what they're doing to make change in their particular sphere of decision making. Where do I think this is being done well? I think the biggest example is probably Amsterdam, where you had a political leader, a deputy mayor, who basically made this commitment and stuck to it over time. He did actually what our London mayor did as well, which was to really use his political capital, like basically started making trade-offs, because I think ultimately this stuff, like everything has trade-offs, isn't it? So you need political leadership means someone saying, this matters, I'm prioritizing it, and I'm willing to take risk and trade-offs around it. So with the advertising ban, for example, and the deputy mayor of Amsterdam did something similar in that he he banned sort of fast food companies from doing any sponsorship of public events. And, you know, they both faced massive challenge on that from corporations who were obviously, you know, worried about they're using advertising for a reason. Yeah, they must face challenge on that. Also, the London mayor, you know, he had people saying you are going to face a massive drop in revenue for TfL if you do that. I mean, that actually, the figures that came out just before COVID hit, which has probably complicated the data. But yeah, but the figures before that actually did show that there wasn't much of a drop in revenue, which I think was interesting.
Really
but he did take the risk. So it's like it's both sort of setting that vision, saying we need to stick to this over time, and then I guess all putting their own political capital on the line. Yeah. And then I think aside from that, I guess what they're doing in Amsterdam and here as well in London, I think is I think with that vision setting, it's saying that change is possible, because with child obesity, again, because of the complexity, there can be a general assumption that I guess it's just something we have to accept in especially in cities. It's just, you know, modern living. Right. And I think there's something else saying change is possible. These systems are designed and we can redesign them. I think the other thing is about saying how it is possible. And when we're thinking about solutions, the solutions designing, really always putting that lived experience of people, of citizens at the very front and center. So kind of starting with what in cities is making it easy and what is making it hard for people to live, to eat well, to move. You know, when you look at it from that angle, you quickly challenge the idea that all we need is, you know, to give people information about what healthy eating is, or about what, you know, what they should do to exercise. When you see, you know, when you speak to families and parents who are saying, oh yeah, absolutely want to buy healthy food options for my child, when you see them navigating a food environment where many things are acting against that, yeah. I think that's, you see what the problem is. I think the other thing is to really put efforts where you're likely to get most bang for your buck. And again, I think it goes back to looking at data and qualitative information from lived experience. So for example, that report we did last year with Food Foundation looked at where people's food spend was going, and 80% of it was going in supermarkets. And I mean, that's across income, which probably says something about, unless you really do something fundamental with supermarkets, you are not going to make a big dent around people's purchasing and consumption behaviors. So I think there's also something about that. And linked to that, for me, there's kind of often not enough emphasis put on the commercial determinants around child obesity. So, you know, what are the incentives for industry and business to innovate, to research, to innovate, to serve citizens with products and services that actually meet their needs, particularly consumers and citizens on a lower income, who aren't necessarily the group targeted by industry with kind of innovation around how you create, you know, healthier products. So I think it's also that kind of having the commercial quite heavily has quite a big role, I think, in that. So those are the main things. And then I think there's a broader thing about how political leaders and urban planners and we all are talking about the issue of child obesity. So when we started scoping the issue, what really struck us was the disconnect between what the global evidence was saying when it was looking at what's actually worked. The global evidence base was saying, oh, it feels what's worked is less interventions that were trying to target willpower or education. What worked was much more interventions that were trying to target the things around people, the urban spaces. When we did a kind of public opinion poll or kind of research into public understanding alongside that, and that was almost opposite to that. Most people across income, education, you know, when they hear child obesity, they think about it as an issue of parental willpower, really, and education. And obviously, if you start there, then all the solutions you're thinking about are, you know, public health campaigns and education initiatives. So I think it's also about how leaders especially are talking about the issue. So we've done quite a bit of research about what are the communications principles that we should all be using around this issues that help people think about it as one of kind of urban design, really, rather than one of trying to convince people to do something differently without changing anything around them. So that's probably the other thing I think is really important when it comes to kind of creating positive conditions for change around the issue.
Yeah, I think it's a really interesting sort of point. I think cities have, and city design especially, has sort of yields so much power to tackle urban crises. And I think that's sort of talking about it, as you say, is the first step. And then as urban designers, sort of designing to tackle it is that important takeaway. And I think we could certainly talk for longer, I know, but I'm afraid that's all the time we've got for this episode. So I want to thank you again, Sarah, and ask that everyone follows and supports your important work at Guy's St Thomas's. And of course, that leads me to thank everyone out there who's listening to this as well. I hope you've enjoyed this episode of ideasSPACE by the Urban Design Group, UrbanNous, and me, Christopher Martin. More episodes coming your way, so please do get in touch if you have any questions, and check out the events page of the Urban Design Group to see more around urban specials. Thanks very much.